here we are. We got Dr. Doug Christianson, you were one of the first testosteronologists, I believe, about a year ago.
I was. Yep, I am.
Yeah, and so far, if you could extrapolate, how has being a provider with the testosteronology benefited you, and how you treat your patients?
One of the cool things is setting up the framework. Dr. O does a great job following his ABCDs and then the risk reduction that comes along with it. One of the biggest problems around testosterone is the fact that you'll have the side effects like androgen-induced erythrocytosis. And most places just have you go and phlebotomize, which it's not a long-term solution. So when you start looking at more of the root cause and everything else that's kind of going on, you see maybe there's a cardiometabolic pathway that we have to address, or maybe there's blood pressure things that are going on. And when you start addressing it and utilizing the correct medications, you not only see the markers go down, which is fun for me as a provider, but also the number one thing is seeing all the patients actually feeling better. And that's like where you are feeling better, you don't have to phlebotomize, and you're enjoying most of the benefits with little to no side effects. That's the goal. So, yeah. And the testosteronology has been, it's been turnkey in my office, because since I've been establishing this framework, my patients are not only getting better, but they have a solution to the problems that come along with it.
What's a brief background about your area of medical practice?
So I'm a naturopathic doctor, and very similar trainings to that of my counterparts, the MDs and DOs, with the first 2 years. So we have our basic sciences that we go for. We have our board exams that we take. And then our last 2 years is where we differ. So in the clinical years of didactic, that's where we learn a lot about prevention, lifestyle, finding root causes. A lot of times we'll use medications off-label use, or all the things that we can utilize for a patient to not only just manage their symptoms, but to possibly reverse it, get them out of the disease state, and then the tools to be able to live a longer or even better quality of life.
So I love your thought process on prevention, because, I find that it's easier to prevent something than it is to treat something when it's already manifested itself. I mean, I feel that currently medicine is like playing to quote Peter Attia, it's like a game of whack-a-mole. Something comes up, you treat it. Well, why don't we just prevent the underlying issue, so we never actually have to essentially be in that situation where we are trying to attenuate actual illness rather than prevent actual disease. So you mentioned using medications off label. And I believe that a lot of medications, can be repurposed, for that reason. For example, we know that Telmisartan has anti-proliferative properties. Okay.
Mm-hmm.
Just to name one, we know fluoxetine has been shown to be able to inhibit GBMs in Petri dishes, so now obviously more studies need to be done, but it looks promising. Now, for the case of what we want to talk about here is methylene blue, because this has now been, and I made the mistake. I initially dismissed this on the forums. You saw that. And I might have made a grave mistake, because this is a medication that's been out since 1876. It was discovered by a German chemist, and it looks like it has mitochondrial empowering abilities due to electron transport. It looks like it has antimicrobial abilities, antiparasitic abilities. So nowadays, though, Dr. Christianson, we see guys with the blue tongues, the blue urine, and this is being known as the ultimate biohacker's cheat code. And, I don't like to use that term biohacker too freely, but today's biohacks just might be tomorrow's standard of care. So methylene blue, take it away, please.
Absolutely. Well, it's a perfect segue from the first part of the conversation we were having, right, about the chronic disease part. And when you look at the mechanism of chronic disease, a lot of times it points to the mitochondria. Either it's being damaged or it's slowing down, or it's, toxins are built up within the cells, preventing mitochondria to function correctly. So when you look at methylene blue, you want to look at where does it go and how does it work? And methylene blue goes directly down on the cellular level, and it focuses more on the mitochondria.
Okay.
And more specifically on the electron transport chain. So it helps as it's an electron donor. So so naturally speaking, mitochondria works with oxidative phosphorylation, right? You need your NAD. Sometimes people use precursors like NMN and NR to kind of help boost up the energy. So in the cell, you have like the cell here, like a little square. And inside of it, that's where the electron transport chain works with NAD. Outside the cell, because methylene blue doesn't naturally occur in the body,
right,
it runs parallel. So, and it bypasses the complexes like 1 through 3, and it helps with electron donors onto the complex 3 section. So then that way ATPase is pumped out more.
So we're now stepping into the Krebs cycle a little bit.
Correct.
Okay.
Because it works
okay.
For the energy production. So that's how methylene blue works, right? It goes in its reduced form like methylene blue, and then it donates the electron, gets oxidized, becomes methylene blue. So that's where how this works in the body. Now, when we start to zoom out, that's where we started to notice like the pleiotropic effects everywhere, because mitochondria is present everywhere in the body. It's dense in the brain, in the heart, organs, sex organs. So that's where when we looked at the chronic disease part of it, and you address the mitochondria and its functions, that's where a lot of people are starting to see some of the benefits of it. And it's really studied right now in the in neuroscience for the benefit.
Yeah.
And a lot of people can contest to this, like especially at the lowest, like lower dosing, methylene blue can have nootropic-like effects. And
that was being studied in dementia, autism, and various neurological conditions,
as well as ADD and ADHD.
Yeah.
So it can help kind of balance the moods in that. Which is, it's also important to note that methylene blue is a mild MAOI, so it can interact with SSRIs, SNRIs, causing like serotonin syndrome. So it's very crucial that when we prescribe these medications, that we are providing the care to the patient correctly and making sure that we do our due diligence to make sure there's no contraindications.
Which is what I think needs to be really addressed before all these people, all these biohackers start to just adopt this into their routine, which I don't advise unless you're under the guidance of a healthcare provider, a testosteronologist, or your local healthcare provider. What was this initially indicated for?
So initially, it was used for methemoglobinemia, and so it's for people who don't really are familiar with it, it's mostly in the emergency room. Sometimes monoxide.
So lack of oxygen getting to the organs.
Correct.
Okay.
So, and it's usually when you look down into like the microsomal heme oxygenase pathway. So that's like right where hemoglobin is broken down. Right. So hemoglobin undergoes oxidative phosphorylation, it attaches an oxygen to it, another iron gets onto it, and it turns into methemoglobin. Okay. So at that point, when you have methemoglobinemia, it doesn't get past that section. And because of the driving factors that it's attaching oxygen and it's not releasing it.
Okay.
And it causes a hypoxic state. And that, which is kind of side note, it kind of is interesting because it kind of holds to the theory of androgen-induced erythrocytosis.
Right.
It's it's driven by hypoxic states. So going back to like how it's broken down, methylene blue pushes that pathway through, so then oxygen can be metabolized. Iron then goes into the mitochondria so that it can be recycled. And then the hemoglobin breaks down to biliverdin, and then it gets broken down into the liver. So it helps push that cycle along. So then hemoglobin is better metabolized, causing for better oxygen utilization at the microscopic
So
level.
if somebody were to take that off label who does not have that condition, would that impact O2 levels on a pulse oximeter?
So it does. So, it can, when you look at it, it can falsely elevate it, making it more like a 102, 103. I've tried it personally, and it's weird. It's kind of trippy. But what's unique about it is
Well,
that,
should be in terms of side effects or just?
oh, it's just kind of psychological, right? You're like
Oh, yeah,
looking
yeah,
down, you're
yeah,
like
yeah. Gotcha, gotcha,
105,
gotcha.
like what, 105%,
Okay.
like, so, that's where, when I started kind of using it, I was wondering if it would help with oxygen utilization for exercises. So, like, what I've noticed is
I like
that
that.
endurance wise, it was able to push through the workouts harder. And I've had more of like that focus. So we started using it with patients. And then what we noticed is that patients who were on testosterone and we utilized methylene blue at the lower end of doses actually potentiated its effect, which is insane because, as you know, the testosterone improves mitochondrial function.
So
So,
if I were to use, just talking about energy levels, this is exciting because if I'm now impacting the Krebs cycle, if I'm now stimulating more ATP with improved electron transport, if I'm increasing NAD levels, would somebody be able to add NMN to this and have an even bigger effect?
yes, that's why we have to make sure that providers are methylene blue aware and NAD aware, because they work they're two different ways, right? You have the natural way where you use NMN, NR,
Yeah.
or NAD, and that speeds up the natural pathway. When you utilize methylene blue, it runs parallel to that system. So you're also going to get energy to it. So it's synergistic. And so and that's where, too much of a good thing can be bad, right?
Yeah.
Especially for patients who are ADHD. Because then when you have an increase in mitochondria at the cellular level, increasing energy, you're going to get energy. And it's different than just taking caffeine.
Yeah. So it's not like stimulant energy.
Oh, you'll still get that. You'll get heart palpitations. You'll get jitteriness. A busy mind, like you can't fall asleep. So, and that's where, and when you look at the dosing structure, you want to make sure that you hit that right. If the patient feels that, you bring it back and you bring them down to find their dose.
So there are levels that this could be taken where it can be toxic.
Very, yeah. But it also ranges too, because, I've had patients take anywhere from like 75 to 100 milligrams of it, and they've been completely resistant to it.
Okay.
And then I have guys who take anywhere from 5 to 10 to 15 milligrams, and they're so sensitive to it, and they get a lot of the benefit. So,
okay. So we're seeing, where does that translate into the antimicrobial, anti-malarial, antiviral effect that I've seen in anecdotal reports?
yeah. So this is what's really cool about it. So it hits everywhere in the body, right? It doesn't have its specific action is the mitochondria. So it hits everywhere, and it targets the mitochondria within the bone marrow. And so then that way you'll see immune stimulation that gets more your body just produces more of the cells it needs to fight off infection.
Okay.
So that's where you see, like in chronic care, like the immune system is under attack. And so it's keep trying to work and work and work to fight. And then it starts to dampen down. And then that's where you see a lot of the problems that come along with that. And methylene blue helps with this is a perfect segue to the next part, but it helps with the reparations of the DNA, so that of the mitochondria. So it will help rebuild it and allow the body to have the energy to then produce the cells to fight.
That is very, very impressive in terms of how it works like that. Now, I want to talk about potential side effects, because every action has an equal opposite reaction. Because everything we're saying sounds so good, but we know there's no free lunch, and we got to be really careful with this stuff, because we know there's a lot of people that are unfortunately probably using this without under the supervision of a healthcare provider. Tell me about the vasoconstriction effects and the inhibition of the CGCMP pathway that leads to maybe hypertension with this.
Yes, and that's where it's dose dependent.
Okay.
100%. And like, it's the threshold that you have to find, and where it will completely reverse the effect of what you're looking for, right? Because it causes vasoconstriction, and we want vasodilation.
Yeah, exactly. So,
And
if anybody
yeah,
listening, I just want to say to everybody listening that, like, one of the things we always talk about in testosteronology is Dr. O'Connor and myself, we're big endothelial guys. So, and you say the words vasoconstriction, that's a bad word to the cardiologists. That's a bad word to me a little bit. So I'm hearing that, I'm like, whoa, hold on a second, because that's high blood pressure. That's not what we want. But hold on a minute, we got to see if the good outweighs the bad. Take this away here.
exactly. And methylene blue is not for everybody.
Right.
Like some people are more sensitive than others, and it really and like when I have my chronic care patients, like I have them on it for maybe a minimum of 3 to 4 months. Like we need to really kind of see how it sets in. The moment they take it, it's like almost instantaneously that they feel a significant difference. Now, if you have your healthy individual who is just looking for a biohacking type of like something like that, and they don't really have any type of underlying disease, um, it will help, especially on the lower dosing, but you don't run it forever. It's not something
Okay.
because
So this
eventually
is a
you want to
transient
cycle.
medication. Okay.
Exactly. And it works in conjunction with the things that you're doing. It's like you won't use this over Telmisartan.
Right.
Instead, you can use it with conjunction with it, which I have been doing in the recent year, where I've used Telmisartan and Nabivolol with methylene blue on my testosterone patients. And it does help with the trending of lowering down the hemoglobin levels as well as hematocrit. It's still borderline. It'll get like I had a guy at 54% hematocrit. He his
For anybody who
hemoglobin
wants to
was
know,
at 17.
54% hematocrit, your blood's like chocolate
Yep.
pudding, but keep going.
That's the limit, right? I'm like, all
Yeah.
right, go donate blood right now. Let's do
Yeah.
it immediate. And then like we got on telmisartan and it started to trend down and it went to it was like 52%. And then I'm like, he's wondering if we should donate blood. I'm like, not yet. Make sure we hydrate, make sure that we're exercising, we're doing all the right things to be able to
Right.
influence a better environment. So there's better oxygen utilization. And then we started using low dose methylene blue, and it brought him down to 50% in terms of hematocrit, and his
Wow.
hemoglobin went down to a 15. And I was like, and this was over a 3 month period though.
No, that's
So
impressive. That's impressive. And
yeah,
you didn't have to phlebotomize.
yep, he didn't have to phlebotomize. And then he started telling me, he's like, Doc, I used to have seasonal depression, especially around this time of the year. And what he noticed was that his mood and perspective on things improved, and he's feeling way more motivated. And the testosterone dose that we've done with him is very like it's like zero point 0.3 twice a week,
So you
so
wouldn't
140
contribute
days.
that to the testosterone. You would say it's the addition of the methylene blue.
So he was on
That's
testosterone for about a
interesting.
year and a half. And he's like, since he's been on testosterone at this dose that we have it, and he's had the methylene blue alongside the telmisartan and the bivolol, it ended up having a great effect on his mental psyche. And so it's very interesting to
What
me. Is
mechanism do you think is at play that's improving the mental state?
it acts as a mild MAOI.
Oh, that's right. Okay, I'm sorry. You're right. You're right.
Yeah. So that's where, like with guys who are on SSRIs
Sure.
and SNRIs, like I had a guy recently that it took about a year to get him off of his SSRI. I worked with his primary care provider, and and there's a certain way you have to do it where you don't cause serotonin syndrome.
Right, 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 right.
And that's where I think methylene blue is really cool to be able to utilize as a tool to help patients coming off these medication and then utilizing other things like testosterone and lifestyle changes to be able to get to the goals that they're looking for.
Circling back, how you're using so we're now, if we're talking vasoconstriction, are we leading to possible issues like erectile dysfunction, or are you using the telmisartan and bivolol to counteract that vasoconstrictive effect of methylene blue?
So, and that's where I'm doing low doses. If they get that, we back that off. We back off the dose. So then, so
Okay.
for the most part, I'm utilizing it as an agent to supplement. And then and like I said, this isn't something that we run for a long period of time. So like we'll run it for maybe like I said, like 3, maybe even 6 months, depending on the disease state that they're in.
Okay. Okay.
But for the most part, I have them also, some guys are, majority of them on like low dose tadalafil. And it kind of, it helps negate a lot of that, but from what I've used, I have a guy that's taking 75 milligrams right now, and he's feeling fantastic,
And
and so
do you
he's
see
got.
transient increases in blood pressure depending on the dose, and by how much?
Yes.
Because that's important.
So yes, and that's where we always have to monitor that. And like, so I saw it increase maybe like 5, 10 points. 10 points was at the most, and that was when I was at more at that 50 milligram mark for one of my patients. He took like 10 milligrams, nothing. 25 milligrams, he didn't really feel much. He took 50 milligrams, and he started feeling some energy. And then he felt pretty good when we
Yeah,
checked
but it
his
was
blood
probably
pressure.
hypertensive.
Exactly. So I'm like, he got energy, but then he got, he was
Now, when you're saying
hypertensive.
5 point, you're saying both on the systolic and the dystolic, or just one?
On the systolic part of it, and the dystolic part of it, it maybe went up like 2 or 3 points. It was very, very,
Makes
very
sense.
minimal.
Makes sense.
Yeah.
Okay.
So
Now go over the dosing. How does the
mhm.
dosing work for this medication? Can it be taken with or without food? BID or twice a day or 4 times? How does it go?
So once daily, and where the rule of thumb is like 0.5 milligram per kilogram up to 4 milligram per kilogram. You want low doses.
Yeah.
That's like the sweet spot. In the emergency room, they use much higher, and it's intravenous too. And I've used it low dose intravenously, and it's pretty cool. It's kind of euphoric, especially at the lower end of dosing. And I definitely say that if you're going to do IV methylene blue, definitely know what you're getting into, because there are some risks along with that.
You
But
do see this in a hospital setting?
not here in outpatient. So like I used to do it at in my like unofficial residency.
Okay.
So like we did adjunctive cancer care. So I did a lot of ozone, high dose vitamin C, curcumin, and methylene blue, poly MVA. Those are all like very antioxidative or
Yes,
oxidative
especially the curcumin.
therapies.
Yeah.
hmm So and then so to get back to the dosing part of it, so when you go back to like the 0.5 milligram per kilogram to 4 milligram per kilogram, depending on the individual, it can be anywhere from like 4 to 5 milligrams all the way up to like 450 to 400 milligrams. And so, and that's where it kind of it ranges from everybody, and that way, and that's why I can't stress enough how important it is that a provider needs to write these prescriptions. And I think this is a perfect point to point out is that methylene blue, you can get it anywhere. And the problem with it is that when it's made from like supplement companies, they'll market it as like pharmaceutical grade, but it's not for human consumption, or they're reagents. And the biggest problem with the raw material of methylene blue is that it's got a lot of heavy metals with it and contaminants. So you might be taking it thinking it's helping you, but you're actually poisoning the cells with heavy metals. And
Okay.
that's like, it's like, you don't want to do that. And that's where, like, I use a compounding pharmacy where we have a certificate of analysis, and to make sure that the purity of it is good. And there are some good online places that you can vet and make sure that you ask for their certificate of analysis,
Do
to make
you
sure that's
regularly
freaking great.
prescribe this?
I do.
Okay.
And
Help me.
I, sorry.
No, I was going to say, help me understand, because this is where we start to get a little saucy, because here's another one of my concerns is, aside from the vasoconstriction, we're now giving a lot of energy to the cell. Okay. What if is there a possibility that we could accidentally be empowering the wrong cells, and we could be basically knocking on the door of a malignancy that otherwise would be dormant, and we're now feeding it energy?
That's a good question. That one I don't know the answer to. I think it's possible if the cells have the mitochondria, right? And that's where I think that if we that's where I think that providers, it just kind of comes back to that, where we have to follow the ABCD framework to
Yeah.
make sure that, our patients we don't recommend them something and end up causing them harm.
Yeah.
And so that's where, you can have people who will take it and they'll take large amounts of it and they'll take
Right.
it for a long period of time. And I'm like, that's not healthy. You're
So
doing
you
the
would
opposite
never
of
recommend
anti-aging.
using methylene blue for a long period of time. It's a transient amount of time.
Mm-hmm, correct.
I agree with that. Especially when we talk about the potential in terms of, accidentally knocking on the wrong cell's door. I think using it in a transient time frame, if it's working, would be something more ideal than using it full time, like 100%. Especially now, since there's still a lot of data that needs to be extrapolated for us to fully understand the power and the properties of this. Now, if as time goes by and you do studies and you see more people who were on this had malignancies than people who weren't on it, then that's obviously something to discuss. Or if more people were having cardiac issues because of the hypertension, it's obviously another path to discuss. So, but it looks like it appears that it has some strong, on the surface right now, it would appear, and correct me if I'm wrong, it would appear that it has strong antioxidative properties. Don't know if it has anti-proliferative properties. Yeah, we don't know yet. It looks like it has strong anti-parasitic, antimicrobial properties. And it looks like it has some neurologic properties because, like you said, it works as an MAO inhibitor. So it looks like it also has obviously some energy producing properties due to the increased ATP synthesis and the more electron transport. Obviously, we're going to have more energy producing in the mitochondria, which is the powerhouse. So, there's some neat stuff about this, though. Like I heard that I think one provider said you could win a bet in a bar because if you're on methylene blue, you could tell somebody, I'm going to drink this beer and it's going to make my urine blue. So what is it? Does it make the urine blue?
It does. It's a dye.
So as in blue, as in the color of this napkin?
And sometimes it can be greenish, depending on the hydration status. But yeah, no, it definitely makes you. And sometimes if you use a troche, it'll taint the tongue blue or the gums, the teeth. So that's generally the big side effect that you'll see with it. There are some other ones there's dizziness or diaphoresis. Those are usually in the higher dosing though. That's when you get into that's where you're the overdose, and that's why I'm low doses kind of stay with within that 0.5 to 4 milligram per kilogram. You're going to stay generally in the clear with all that.
So when you have that patient that comes into your clinic to see you, the patient that you prescribe methylene blue for, what does that patient look like?
Usually they have cardiometabolic symptoms coming in. So either insulin resistance, type 2 diabetics.
Okay.
What I've been really utilizing it a lot with is my peripheral neuropathy patients. So at my office, I have a device where we use electrical self-signaling, and then we utilize methylene blue. And it's been able to help improve my patient's symptoms anywhere from 80 to 90%, and over a 6 month to a year program. And it's been really cool to see it because a lot of these patients also have neurodegeneration. So their memories, their moods are declining. And by the end of the year of working with us, we're seeing that they're feeling better, they're happier. Not only are they no longer in pain, but the mood subset part of it is they're feeling pretty good. Their immune system's a little bit better. Yeah,
they can impact on labs, A1C, cholesterol, blood sugars. Go ahead.
I haven't seen so much really in that because it's not like you're using this medication as the primary driver. You're using it as a supplement to help the mitochondria. So the other things on top of it, making sure we're addressing sleep, stress.
So it's not going to make a lab sheet look much different.
Exactly.
Okay, I got you.
Yeah.
So, all right, who is not a candidate for this drug? And what do you know any contraindications with other medications or other conditions?
So patients who are on SSRIs, SNRIs, or TCAs, those are definitely a no-no. Or if you're trained and you can handle the patient to work them off with it, you can, but you just have to make sure you know what you're doing. Then that's pretty much the major contraindications. And then anybody who's pregnant, breastfeeding, definitely not. Just kind of make sure that you don't affect anything with the fetus in development. So that's about it from what I found. And generally speaking, to people who are ADHD or ADHD, they definitely have some benefit to it, but they have to be careful again. It's just kind of, it ranges in what they're dosing, how they feel, the spectrum of ADHD that they're on. So
this was really good. So to sum it all up, it looks like we have a promising agent, a promising pharmacological agent that has been, in use since the late 1800s, and that has demonstrated some anti-parasitic, antimicrobial, antioxidant like effects, and some mood stabilizing effects. I think that as time goes on, more data will be extrapolated, but it looks like what we're hearing has been really promising in terms of from a patient perspective. But it's really good that we all understand the risks behind everything that we're doing, and every action has an equal opposite reaction. And as time goes on, hopefully more studies become available, and we could see if this could possibly be repurposed.
Absolutely. And what's really cool is the study that came out last year in cancer. So where they used some chemotherapy drugs, and as you know, it's very harsh on the body. Yeah. And where they saw where there was a lot of kidney damage, that methylene blue actually did reparation to the mitochondria, reversing the damage that was done to the kidneys. And which is so interesting, because how it does it is through the NRF2 ARE signaling pathway. And what that does in particular is it goes down and it blocks the gene mutation. It's like 8OHDG gene. Okay. You can test it in the urine test of like doctor's data. It's like $100, but it actually repairs that part of the gene mutation from the
chemotherapy.
Mm-hmm.
So we're looking at, and I mean, this is what I'm saying is really far out here. Nobody take this to heart just yet, but what you just extrapolated on, it warrants further research, I will say.
100%.
In terms of using methylene blue as an adjuvant to chemotherapy to prevent possible side effects from chemotherapy, maybe some cachexia, maybe some organ damage caused by chemotherapy. So very, very impressive so far. So we'll see. We'll continue to see what comes with this medication. Ultimately, I would never advise, neither would you would never advise somebody to use this on their own without under the guidance of either a testosteronologist, which we have. You're accepting new patients, right?
Yes, I am accepting.
If anybody wants to get a hold of Dr. Christianson, you can. You get on the Testosteronology site, you go find a provider. And where are you based out of?
I'm in Palm Springs, California.
That's right, yeah. So, and you do telehealth, correct?
I do.
You do telehealth calls, and he's definitely ready for patients. So, we don't want to do this on our own without under the guidance of a healthcare provider, because these do come with side effects, as we both extrapolated on. So do not do this on your own doing. Currently, yes, this is, I would consider a biohack, but today's biohacks could be tomorrow's standard of care. And I think that concludes it. Sounds good. Thank you, Dr. Christianson.
Andrew, it was so good talking to you, man.
Sounds good.